Hello, this is Class 1, Lesson 2 of the Clinical Operations Management Program. I'm Daniel.omorain. This lesson will cover how to learn the SOPs that you'll be required to learn in the onboarding period in a focused and efficient manner. So this is the syllabus for the complete Clinical Operations Management program. We are still in Class 1, and all the videos up until this one have been Lesson 1 of Class 1, which was onboarding. And today we are doing Lesson 2, which is SOP. And the plan of this video is, first of all, to talk about why it's important to have a systematic approach to learning SOPs. Next, I will tell you how I build the Excel worksheet. And lastly, I will describe how I use it and use a fictitious example of how it's used. Learning your company's SOPs is a very, very important step for you to becoming a productive contributor to your organization's efforts. SOPs should be the foundation that all other actions are built upon. The leaders have written the SOPs, they have vetted the SOPs, they have approved the SOPs, and they have determined which SOPs are important for you in your role to know and be exposed to during the onboarding period. In a way, this onboarding period is a little bit like basic training in the military. That you have to get the basics right. And if you don't, everything else will be weak and unpredictable. The challenge in the onboarding period is that you have very few things to do other than study the SOPs. And if you're not careful, the process of reading them might become a little bit like a visual equivalent of white noise, that it's a little bit numbing. And you have to figure out a way to pay attention so that way, if you do come across something that is critical to your role, that you appreciate it and that you absorb it. A way that you can do that is to use an Excel spreadsheet to capture the things in the worksheet that are particularly critical, things you don't want to make a mistake on. What you should do, regardless of your level in the organization, is to learn the responsibility of the level above you and the level below you. If you're a CRA, you should learn what the lead CRA is responsible for. If you are a CTM or a lead, you should know what the CRAs and the project manager is responsible for. Good leaders don't let their followers fail. Good followers don't let their leaders fail. And one thing you can do is to know what your chain of command responsibilities are, so that way you can help your teammates to make sure that there are no errors or omissions. Just be a good teammate. And when you think about it, the onboarding and SOP period is a really good deal, and it's a bit of a gift because you don't have any responsibilities. You have 1 week to submit a timesheet and to do your SOP training. So use that time wisely and learn your SOPs. It will pay off. So this is an example of a worksheet that I use to capture important parts of SOPs. The construction is very simple. The top row, I have the SOP name, the SOP abbreviation, the SOP version date, and that's very important. Then the three columns that I put in, because I've always worked in ClinOps, are CRA responsibilities, the lead or CTM responsibilities, and the project manager responsibilities. And for this scenario, what I did is I created this fictitious MV002, which deals with site startup activities. So a typical SOP would have things like this. For the CRA in column E, conduct the SIV after documentation of IRB approval is obtained from the site. So like I was saying earlier in this recording, all of these SOPs have a lot of material in it, but only some of it applies to your specific role, and only a portion of that is critical. I'm using this worksheet to capture the things that are critical, so that way I can interact with the SOP and hopefully learn it faster. So continuing on line 3 here, a lead responsibility might be ensure that the SIV is conducted within 14 days of the contract being fully executed. And then I put a note in here, an explanatory note from the PM. Ask the site for an early date if the site looks promising. So that way we don't have to wait until the contract is fully executed before we ask for a date. And then continuing on line 3 here, the project manager role would be ensure that regulatory gets a report of any 483s for the PI, and that regulatory gets the licensing status of all of the investigators that are on the 1572. So line 4 here, I included as an example of what happens if a new version of the SOP comes out and any salient information in it. So I created this scenario that the new SOP, which is dated 15 February 2025, has a new restriction or a new piece of information. The SIV can be conducted only after the the investigational product has been received at the site. And of course, this depends on the sponsor. So this is a simple worksheet. You got the columns across the top, and then you fill it in depending on what you read in the SOPs. So my thinking is the more that you interact with something, the more you learn about it. And that's what I'm trying to do with this worksheet. I'm trying to interact with the SOP so that way I learn the contents. What's really important to know is that there is an SOP, and when it comes time to do things like site startup, that you find the SOP and you reread it and study it, because there's a lot there for the, especially for the. Anyway, use this worksheet to learn the SOP. Work hard during the SOP period, because if you do, things will become easier. And if you don't, things will become scary and uncomfortable. So, in summary for this lesson, I have talked briefly about why it's important to commit to learning SOPs. I have described the worksheet that I used to capture important information that I read in the SOPs. And I've talked about how to build that worksheet and then use that worksheet. Now I want to share a caveat about this approach. And my caveat is this: if you actually do commit to learning your SOPs well, there's a reasonably good chance that you'll be ahead of your manager, and that might cause some problems. I have always been sort of the nerd of the group who does things correctly, who prepares well, who reads the documents, and basically takes a professional approach to learning and my job. And I've had several situations where, because of my practice of reading SOPs and reading plans, it became obvious to me that the managers had not invested as much time and effort into learning these documents as I had, with the result that I discovered that things were not being done according to the SOPs and the plans. And the result for me is, first of all, I lost confidence in the manager because the manager clearly had not invested time into learning the documents. And second, I lost confidence in the organization, that the managers were not doing things according to their SOPs and their plans, and no one discovered it. One of my beliefs about clinical research is that there are three big opportunities for improvement. One is the training of the CRAs. Two, the supervision of the managers. And three, an over-reliance on perpetuating the status quo. So what we're talking about here with the SOPs would be the second one. I've come across situations where the managers weren't doing a very good job, and it was very disillusioning, because I think that we all have a very, very important job to do. To protect subjects, and to find out whether the drug is safe and if the drug is effective. We all contribute to that, and we all have an important part to make sure that things are done correctly so those two missions, or those three missions, can be accomplished. So I recommend that you do invest the time to learn the SOPs, but just be forewarned that in the process of doing that, you might reveal some weaknesses in your organization. So that's the end of this lesson. And actually, this is the end of class 1. Class 2, I'll begin my presentation for project management and project management within the context of clinical research.